Hello guys, I welcome you all on Unacademy, India's largest learning platform. Myself, Dr. Nidhi, I'm your physiology educator at Unacademy. This is my page on Unacademy, that is unacademy.com/KGMC. You can follow me out there so that you will get link of many more classes which we are taking on our Unacademy app. This is the code Dr. Nidhi. If anybody wants to join the paid course, you can use this referral code to get additional 10% off. I've taken many plus classes, many special classes, so anytime you can join and revise your topic. Let's embark your NEET PG 2023 by the amazing offer we are going to have, and in which when you take the subscription of 1 year, you will get a free 6-month extension. So this is an amazing offer. So do enroll yourself right now by using the code. This is Dr. So price rise of up to 20% is going to be very soon. So save yourself from this price hike by you enrolling yourself right now. To enroll yourself, do use the code Dr. Nidhi to get additional 10% off in your subscription. We are having three type of subscription: a plus subscription, iconic subscription, and an academy light subscription. First, coming to this plus subscription, what all are the benefits? You will be able to access both the live and recorded session. किसी वजह से आपका session miss हो जाता है तो you can see the recorded version. You have an opportunity to learn from India's top educator for the medical examination. We always conduct this live tests and live quizzes. From that, you can analyze your preparation at any point of time. You have a flexibility. You can study on the device of your choice. You always carry your phone with yourself, so you can access your class anywhere. We have a question bank which consists of 25,000 plus question, high yield question, clinical based question, and with explanation. So this is going to be very beneficial for all of you. Next is the iconic subscription, where you get access of India's two best platform, that is Unacademy and the Prep Ladder. So you are going to get all the plus benefit. Like I said, live classes, recorded classes, question bank, live tests, live quizzes, and the PDF. Along with that, you get access for this Prep Ladder. In this, you can access the clinical and integrated essential of Prep Ladder, video lecture from the Dream Team, Question Bank 3.0 with active guidance, rapid revision, and snapshot, and you will also be provided with their treasure and dream notes. So if you want to access this Prep Ladder, also go for the iconic subscription, everybody. Special class feature, our special class is also free of cost, but they are way more special from YouTube session because they are always and always a live interactive classes there. Polls feature is there, that is very engaging feature. Raise a hand feature is there. Now you can talk to your educator in the live session. If you follow any educator, you will get notification of their upcoming class. After the lecture, you can download the PDF and revise it anytime, anywhere. We are having this Unacademy Lite for NEET PG, where you get access of all the NEET PG test series, like subject wise test series, system wise test series, full length mock test paper, previous year question paper, test series curated by top educator, and all the grand tests for this NEET PG, like NEET PG, INSET, and FMG will be included in this test series. So if you are looking for only the test series, you can join this Unacademy Lite. So moving further, this is the free test calendar of this week. Moving further, we are started with this batch on UPSC CMS and previous year question batch, which was started on 23rd May. We are started this batch also. Target Next 2023 subject wise batch, that is started on 25th May. 6-month total duration is there. So you can enroll yourself if you are targeting the next NEET PG. So we are having this feature also, NEET PG previous year question bank, where you get 4-year paper of all the examination like NEET PG, INSET, and FMG, and that is going to help you to quick revise before the examination. And 180 question is now available for the free user also. We are started with this auto daily practice paper. After every plus classes, you get a 5 to 10 MCQ that is handpicked by your educator, and that is related to topic you studied in that session, and that is going to enhance your conceptual understanding. We are launching this UPSC CMS. So 1 month fee, the pre-launch price is 2,475. 2-month fee is 4,500 only. So we are started with this first batch also. 3-month prices 4,950, 6-month prices 9,000, 12-month prices 10,800 only. This is the fee structure of all the NEET PG Plus subscription. This is the fee structure of Plus subscription. This is the fee structure for the Iconic subscription. This is the fee structure for the Light subscription. And this is the fee structure for Sports Prof. So moving to our topic today, we are going to study about the cell membrane. So first coming to the introduction part, the most accepted model for the cell membrane is the fluid mosaic model. What does this fluid mosaic model state? It states that our cell membrane consists of lipid bilayer in which proteins are embedded. Now basic composition, when we are talking, the cell membrane consists of a lipid bilayer which is a 40%, protein is 55%, and carbohydrate is only 5%. So we can say the major component of our cell membrane is the protein and the minor component is the carbohydrate. Is this clear? So next, the important point is when we are talking on the basis of weight, lipid and protein are present in equal ratio. That is 1:1. But when we are talking about composition, lipid is 40% and protein is 55%. But when we are talking on the weight basis, they are present in equal ratio. So you see, this is the diagram of an almost all cell membrane. These are the integral protein. Different type of proteins are there. Peripheral protein, integral protein, lipid anchored proteins are there. Integral protein are also of two type, channel protein and the carrier. And this is the phospholipid bilayer is this one. This consists of a phosphate head and the fatty acid tail. This phosphate head is hydrophilic in nature, while the fatty acid tail is hydrophobic in nature. So that's why we can say this phospholipid is amphipathic. Okay? Is this clear with everybody? Now coming to the detail of each component. First component is the lipid, which is 40%. Three forms of lipids are there in our cell membrane. The most abundant one is the phospholipid. Then we have glycolipid and the cholesterol also. So first coming to this phospholipid. The various type of phospholipid are there in our cell membrane, and the foremost important one is the phosphatidylcholine. This phosphatidylcholine is also known as lecithin. This is the major lung surfactant. This point is very important. Do remember, this phosphatidylcholine is the major lipid of our lung surfactant, and this is important because from this we can assure the fertile lung maturity. Okay, so first one is the phosphatidylcholine. Next one is our sphingomyelin. This is the minor surfactant lipid. This one was the major and this is the minor. This ratio, lecithin upon sphingomyelin ratio, should be greater than or equal to 2 for adequate fetal lung maturity. Okay, besides surfactant, it is also a part of nervous cell membrane, this sphingomyelin. Okay, so this was about phosphatidylcholine and sphingomyelin. Next one is the phosphatidylserine. They are basically present at the inner side of a cell membrane. So whenever they are present at the outer side, they signals this apoptosis. So what is this apoptosis? Anybody? This is a programmed cell death. So whenever this phosphatidylserine is present at the outer side, it signals this apoptosis. Next component is the phosphatidylinositol. This IP3 is a precursor molecule of our secondary messenger, that is IP3 dicalcium. So do remember this one. This is a component of our secondary messenger IP3 dicalcium. This phosphatidylinositol. Next one and the last one is our cardiolipids. They are present in the mitochondrial membrane of our human heart. So whenever this anticardiolipin antibody is present, it is present in the serum of syphilis patient, and that can be tested by this VDRL test. Okay, so these are different type of phospholipid. Are phosphatidylcholine, which is also known as lecithin, sphingomyelin, phosphatidylinositol, phosphatidylserine, and the cardiolipids. Now moving to the next type of lipid, that is known as a glycolipid. They are the most commonly present in brain and GIT in the two isoform, that is the gangliosides and the cerebrocytes. Okay, and the last form of lipid is cholesterol. This cholesterol basically provide the membranal fluidity, and do you remember this membranal fluidity is required for optimal function of our membrane, and this fluidity is provided by our membranal cholesterol. So we all know the precursor of cholesterol, the precursor of vitamin D is our cholesterol in our skin, like our 7-dehydrocholesterol, which is present in our skin. When it is exposed to UVB that ranges from 280 to 320 nanometer, then vitamin D is a form. So there is the two function of this cholesterol. It provides the membranal fluidity and it acts like a precursor molecule of vitamin D. Is this clear? So this is about all the type of lipid. Phospholipid is there, glycolipid is there, and the cholesterol part. Okay, different type of phospholipid was there. Phosphatidylcholine, which is also known as lecithin, sphingomyelin, phosphatidylserine, inositol phosphate, and the last one was cardiolipin, which is basically present in mitochondrial membrane of human heart. Anticardiolipins antibody are present in syphilis patient, and that can be tested by the VDRL test. Next was the glycolipid. Glycolipid basically present in our GIT and the brain, and two form of glycolipids were there: gangliosides and the cerebrocyte. And the last one is the cholesterol, which provide the membranal fluidity and it act like a precursor for vitamin D. Two type of fatty acids are there, we all know: unsaturated and the essential fatty acid, and next one is saturated fatty acid, which is also known as trans fatty acid. First, coming to this unsaturated fatty acid, which is also known as essential fatty acid. This fatty acid is required for membranal fluidity because it increases the membranal fluidity. In this, we have linoleic acid, linolenic acid, and arachidonic acid. And as trans fatty acid, which decreases the membranal fluidity, are stearic acid and the palmitic acid. So do remember, the fatty acid that increases the membranal fluidity are unsaturated fatty acid or the essential fatty acid, while the trans fatty acid, which is saturated fatty acid, decreases the membranal fluidity. So this point is very important to remember. Is this clear with all of you? Okay. So moving further, now coming to the next component, that is the proteins. They are the major component of our cell membrane. 75% is our protein. So they are the major component. Different type of proteins are there. We see in the diagram. Transmembrane protein, which is also known as integral protein. Peripheral protein is there, and the lipid anchored protein is there. So first, coming to this transmembrane protein. This transmembrane protein means they basically cross the whole cell membrane. Okay. So suppose this is the cell membrane. This consists of bilayer phospholipid layer. So this transmembrane protein basically cross the whole membrane, and it can be either the receptor or transporter. For example, we have a G protein coupled receptor. It is a classical example of a transmembrane protein. Our sodium potassium pump is also a classical example of a transmembrane protein. Next type of protein, that is known as the peripheral protein. This peripheral protein, what is the function of this peripheral protein? They are supportive in nature. and they provide the structural integrity. So this point is important to remember. The peripheral protein are providing the structural integrity. So in RBC, the peripheral protein that is present is spectrin and then chirin, and in the skeletal muscle, the protein which is present out here is dystrophin. So whenever the mutation occur in this peripheral protein, the structural integrity will be hampered. So what happened? When mutation of this spectrin occur, the structural integrity of RBC hampered and it leads to hereditary elliptocytosis. Whenever the mutation of this enchirin occur, the structural integrity of RBC is hampered and it is going to cause this hereditary spherocytosis. And whenever the dystrophin mutation occur, it is going to hamper the structural integrity of a skeletal muscle. So it is going to cause this Tachyna muscular dystrophy. So do remember this point. The peripheral protein is required for maintaining the structural integrity. Is this clear with everybody? Okay, moving further, the last type of protein is known as the lipid anchored protein. And they are also known as glycosyl inositol, glycosyl phosphatidyl inositol protein. In RBC, the lipid anchor protein is CD55 and CD59. They are basically the decay accelerating factor. They are present in the RBC membrane and they prevent the complement attack. So whenever the defect occur in either the CD55 or CD59, what happened? The complement attack will be there on the RBC. So RBC will be damaged. So hemoglobin will be released in the urine. So that's why it is going to cause this paroxysmal nocturnal hemoglobinuria. Is this clear with everybody? So the lipid anchor protein is also known as glycosyl phosphatidyl inositol protein. In RBC, we have CD59 and CD55. They are present on the RBC membrane and they prevent the complement attack. So whenever the defect occur in this CD55 or CD59, what happened? Complement attack will be there. So that's why RBC will be damaged. Urine में हमारा क्या मिलेगा? Hemoglobin. So that's why it is going to lead this paroxysmal nocturnal hemoglobinuria. Okay. So moving further, the last component and minor component of cell membrane is our carbohydrate. Only 5% of our cell membrane consists of this carbohydrate. What is the function of this carbohydrate? It provides asymmetry to our membrane and they are responsible for immune reaction. So this point is important. Do remember the carbohydrate is responsible for providing the immune reactions. Okay, now coming to the last point, the protein concentration varies with different cells. So what happened? There are some membrane where the protein concentration is more as compared to normal. The normal protein concentration is 55%. Okay, and the lipid concentration is 40%. But there are some membrane where the protein concentration is more than the 55%. So they are having high protein and lipid concentration ratio. In this, we have an example of inner mitochondrial membrane, which consists of a 76% protein. And the presynaptic membrane has also high protein concentration. It consists of a 70% of protein. While there are some membrane जहाँ पे lipid का concentration ज़्यादा होता है as compared to protein. So they are having high lipid is to protein concentration ratio. So in this we have the classical example our nerve cell membrane like Schwann cell membrane and the oligodendrocyte. So do remember the nerve cell membrane have higher lipid concentration. Okay, is this clear? Okay, moving further to the question part. So first question of today's session, cell membrane of a cell is freely permeable to 3 ions. Okay, that is Z, X, Y and Z. At resting membrane potential, the respective equilibrium potential of X is minus 30 millivolt and Y is minus 40 millivolt. What will happen to the membrane potential if it is infused, if a drug is infused which block the permeability of a Z? Depolarization, hyperpolarization, and no change, hyperpolarization following repolarization? So everybody answer this question. Cell membrane of a cell is freely permeable to 3 ion, that is X, Y, Z. The potential equilibrium potential of X is minus 30 millivolt. Equilibrium potential of Y is minus 40 millivolt. What will happen to the membrane potential if a drug is infused which block the permeability of a Z? X and Y is creating the potential of minus 30 and minus 40 millivolt. So what happened? The potential caused by this X and Y is equal to minus 70 millivolt. And the potential caused by Z will be plus 70 millivolt, because at the equilibrium, the summation of potential ion caused by all these ion is equal to 0. So out here, what we had done? We had done that we block the drug with, we give the drug which block the permeability of Z. So it is not going to cause a minus 70, sorry, plus 70 millivolts. So what happened? It is going to cause, this ion is going to cause a minus 70 millivolt. So it is going to cause membranal hyperpolarization. Is this clear with everybody? Membrane will become negative. So it is going to cause hyperpolarization of our membrane. Is this clear? Coming to the next one. This is the same one. When no net electrogenic transfer is there, what is the value of a Z? Z will be minus of X or minus of Y. So it will be plus 80 millivolt. Is this clear? Okay, moving to the next one. Plasma membrane is mainly composed of cholesterol, carbohydrate, phospholipid, or the protein. Everybody answer this question. Plasma membrane is mainly composed of. Yeah, that is very true. It is mainly composed of a protein. 55% of our membrane consists of a protein. Coming to the next one. Eukaryotic plasma is made up of all except carbohydrate, triglyceride, lecithin, or the cholesterol. Eukaryotic plasma membrane is made up of all except. Eukaryotic plasma membrane consists of carbohydrate, we discussed. Okay, 5% was the carbohydrate. Lipid in the form of cholesterol is there. Lipid in the form of lecithin was there. Triglyceride is not a component of our cell membrane. Okay, so answer is B. Coming to the next one. Which of the following major mineral is a component of a biological membrane? Potassium, sodium, calcium, or the phosphorus? Which of the following a major mineral is a component of a biological memory? Yeah. Our membrane consists of a phospholipid bilayer. So the major mineral is phosphorus. Very good. Coming to the next one. True about a lipid bilayer of cell membrane. Asymmetrical arrangement of cell membrane component. Lateral diffusion of ions. Symmetrical arrangement of cell membrane component. Not made up of amphipathic lipid. True about the lipid bilayer of a cell wall. Yeah, lipid bilayer provide the asymmetrical arrangement of our cell membrane. Some are anchored with the protein, some are not anchored with the protein. So they basically provide asymmetry. Coming to the next one, in cell membrane, the following are true. Lipid are regularly arranged, lipid are symmetrical, protein are displaced laterally or none. Everybody answer this question. In a cell membrane, the following are true. Lipid are regularly arranged, lipid are symmetrical, protein displays laterally or none. In cell membrane, all proteins are displaced laterally, lipid are irregularly arranged, so they provide asymmetry. Coming to the next one, membranal fluidity is increased by stearic acid, palmitic acid, cholesterol, or linoleic acid. Membranal fluidity is increased by. Membranal fluidity is increased by unsaturated fatty acid or the essential fatty acid. In this, we have linoleic acid, linolenic acid, and arachidonic acid. So answer is D. Coming to the next one, function of a cholesterol in a plasma membrane. Help in transport of ions, help in exocytosis, maintain a fluidity, help in synthesis of a bile salt, bile acids. Sorry. Everybody answer this question. Function of a cholesterol in a plasma membrane. Yeah, Cholesterol provide a membranal fluidity and it act like a precursor for vitamin D. Coming to the next one. Decreased protein lipid ratio is seen in inner mitochondrial membrane, outer mitochondrial membrane, sarcoplasmic reticulum, or the myelin sheath membrane. Decreased protein to lipid ratio is seen in. It is seen in our nerve membrane as oligodendrocyte and Schwann cell membrane. So answer is D. Coming to the next question. On a weight basis, the membrane contains protein and lipid in a ratio of 1 is to 2, 2 is to 1, 1 is to 1, or 4 is to 1. On a weight basis, the membrane contains the protein and lipid in a ratio of on a weight basis, they are present in equal amount. So that is answer will be 1 is to 1 equimolar ratio. Next is the peripheral cell membrane proteins are pump, channel, adhesion molecule or enzyme receptors. Peripheral cell membrane proteins are our adhesion molecule are the peripheral proteins. Coming to the next one, the most permeable to pure phospholipid bilayer, oxygen, sodium chloride or water. Most permeable to pure phospholipid bilayer. The most permeable to phospholipid bilayer. All the gases will be most permeable to our phospholipid bilayer. So the oxygen will be answer. Answer will be. Coming to the next one, most diffusible ion across the membrane is sodium, potassium, chloride, or none. Most diffusible ion across the membrane is most diffusible ion across the membrane is, sorry, it's a potassium ion, not sodium. Most diffusible ion is potassium ion. Coming to the next one. Okay, this is not related to today's session. That will be discussed in next session. Okay, that was the last question of today's session. Hope you all liked the session. Hope you all understood the session about all the topic related to our cellular membrane. So thank you so much for joining. If you like the session, do like and share. That is important. And subscribe our channel, that is Unacademy Live NEET PG, and press the bell icon so that you will get notification of every upcoming classes. So regular मेहनत करते रहिए. You will definitely able to achieve your target. You will definitely crack an exam with good rank. So let's crack it together, everybody. This is the code Dr. Nidhi. If anybody wants to join any paid course, you can use this referral code to get additional 10% off. That's all for this session. Thank you so much for joining. See you all in the next session. Bye bye.